Good afternoon, I'm Mabel Jong, and you're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. And I'm so pleased to have in the studio Jesse Cureton, who is Chief Consumer Officer at Novant Health. Hi, Jesse. How are you?
Hi, Mabel. How are you?
Very well. This is an exciting time for Novant and for you, who really specializes in knowing as much as you can about the consumer.
Absolutely.
You had talked about putting consumers in different buckets. So do you know a lot about the people that you're working with?
Well, you know, first of all, these are exciting times in healthcare, and anyone that's in healthcare that doesn't realize that there's a different consumer today than there was even 2 years ago, yet alone 5 or 10 years ago, are really missing a unique opportunity. At Novant Health, as part of our remarkable patient experience, in addition to understanding that we have to make healthcare remarkable, we also understand that we have to look at the consumers differently. You mentioned buckets, and from our standpoint, there are really 3 key buckets to focus on. One is that non-consumer patient. You know, that's the population out there today that on the clinical side of healthcare, it's the patient that's healthy and are not coming into our facilities and rarely are not thinking about us. From a marketing standpoint, that non-consumer patient is that individual that we have to focus on. It's the individual that we have to get to think about us long before they ever need us. And to do that is forcing healthcare to start thinking about what we do differently. Can you imagine if people are thinking about healthcare as a destination long before they have any type of acute needs? Maybe we will call ourselves in the future institutions of wellness, or maybe we'll talk more about nutrition and overall community wellness. So that's the first bucket. It's an enormous opportunity for us to get that group to start thinking about us. The second bucket is really that focus that most healthcare systems have, and that's really the patient consumer. Well, that's easy to understand because that individual has an acute need, they have a reason to visit one of our clinics, they have a reason to visit one of our hospitals. And that's the group that we have to look at and understand clearly. We have to know that there's maybe a propensity for illness, but more importantly, that we have to understand that we have to take care of that segment. But even within that bucket, we've identified at Novant Health that there are about 6 to 7 different segments within that population from all socioeconomic, demographics, and they want us to engage them differently. They want us to communicate with them differently. They define access differently, and they have different levels of utilization around technology. And we want to make sure we meet them where they are. That third bucket, however, is the most interesting bucket in my view. You don't know this, but my background is financial services, and one of the things that we use specifically and intentionally was the term client. For us, a client was different than a customer. A client was someone that we had a very in-depth relationship with, and it was an individual that we could grow. Not only from an overall business standpoint, they were benefactors, they were ambassadors of the organization. That opportunity exists in healthcare as well. That patient client is someone that is connected to the organization and has a major impact over a lifetime for the organization.
Now, connecting back to your first bucket, people who aren't even thinking about healthcare, how do you engage those folks when they may not think they need to think about you?
So what we have to do at Novant Health, we have a program that we call Remarkable You. And it's really a program focusing on that non-consumer that's healthy today. And we want to remind them, even though they're walking healthy, there are things that they need to be considering. We want them to think about screenings and getting tested for diabetes. We want them to think about wellness. We want them to focus on their obesity, if that exists, and as well as hypertension and high blood pressure. So that's just one example of a community program that we have that's forcing people to think about wellness and thinking about screenings and testings long before they may have a reason to be tested. We're also looking at community partnerships where we're partnering in the community as an effort to tell our story, who we are at Novant Health, because ultimately the goal is to create a collaborative partnership within the community where consumers view Novant Health as a part of the community and as a destination for information, again, long before they need us.
Okay, now getting back to consumers and how they make choices, how does it affect what you do at Novant Health?
Well, clearly, we're in a different time. There are a lot of competitors that are involved in the consumer healthcare space.
True.
So our ability to get a consumer to identify us, whether it's one of our access points, whether it's a Novant Health Express, whether it's one of our clinics, or one of our facilities, is extremely important. if we have the privilege of that individual connecting with us, we then have an opportunity to deepen the relationship and really to expound upon what we call our remarkable patient experience. So in this very competitive environment, it becomes real important that when they think about healthcare, we become that first contact that comes to mind.
How long has Novant Health been in this space?
You know, Novant Health, when you talk about the legacy organization, has existed for hundreds of years. The whole notion of consumer focus is not new for Novant Health. I can tell you 3-4 years ago, Novant Health was very intentional in looking at transformation within our healthcare facilities. And we looked at the time that was spent around the bedside. And one of the things that we identified, Mabel, was that our nurses were only spending about 20 to 25% of their time around the bedside. We made the decision to change the operational model for our nurses, leveraging administrative staff, leveraging nurse practitioners. And where we had gotten to today is now in a 12-hour shift, our nurses are spending 70% of their time around the bedside. Now what that means is, because of that, we have better patient satisfaction, we have lowered readmission rates, and at the end of the day, the savings that we've created by that efficient operational change has allowed us to push those savings to cost of healthcare, which ultimately benefits the consumer. And so we're not new to this whole notion of the consumer and focusing on the consumer.
So, but now the consumer is focused more on being an educated consumer.
That's
so how
exactly
has
right.
life changed at Novant Health?
Well, you're talking about WebMD, and so the innovation of technology and the access to so much information, on one hand, has created a better patient. At the end of the day, an engaged patient, a more knowledgeable patient is a better patient from a healthcare standpoint. It's also caused us to respond to the fact that we're dealing with a consumer that has a better understanding of healthcare, so we have to be prepared as well. We have to be prepared from a knowledge standpoint, and we also have to be prepared in leveraging technology to provide access information. My chart is a great example of the need of that more informed, intelligent consumer. It's our way of our patient being able to access information through us electronically. They can look at their lab work through their physicians. They can make appointments with their physicians. We have over 435,000 MyChart participants, one of the largest in the country that's utilizing that technology medium.
Okay, well, Jesse, we're going to have to leave it there, but we look forward to catching up with Novant again.
Mabel, thank you so much for your time.
Thank you.
Right.
And I'm Mabel Zhang. Thanks for watching.